I'm Barbara with Beach Fitness.
Allie with Soul Healing Essentials.
Hi, I'm Piata.
And this is Candace
We have a
Lopez,
special
Dr.
guest
Candace
star.
Lopez.
Hello. I'm here to talk about acupuncture and Chinese medicine and why it is a brand of functional medicine that is very, very old and useful.
Very old.
Very old.
Useful.
And your company
Very
name?
useful. The Needle and Leaf. So you can find me on Instagram at Needle and Leaf.
And she works right out of here at Beach Fitness.
I do. My office is inside of Beach Fitness, and I
We'll
love
put
it.
a link in the comments.
That'll be great.
Mhm.
Yeah, that way people can see all my crazy pictures.
So we wanted to bogart Candace's time today,
Yay.
Dr. Lopez's time today, and ask her a couple of questions that, we kind of ask you questions on a regular basis. We're always like, tell us more.
Yeah,
you
I
know?
love it. Yeah.
But she's so likable, you know?
Oh, I just love Chinese medicine, you know.
So for me, it was mostly about how can acupuncture improve mood, and I know that it works. I mean, I'm proof that it works because I see you, I don't know, like once a week, sometimes twice a week,
Yeah.
and I've changed 180 for sure in the last couple of weeks, and I
Yeah.
think I owe you a huge amount of gratitude. Thank
That's
you
so
much.
great, yeah.
But so mood for me would be my biggest one. Well, I have other issues, obviously, but that's what I want to talk
We
about
all
today.
do. Like, we're human.
Yeah,
You know, everyone's a human being.
So how would, I know that it works, but can you explain why or how?
Yeah, sure. So, like, the beginning of Chinese medicine in the United States, they started with pain management studies. So they thought it was an endogenous opioid system that the needles affected, but it's more than that. So, like, as you needle a patient and as you integrate into their meridian system, they're kind of like nodes scattered throughout the body. So, like, all of these crossing points are developed in utero, and if you put a needle in there, it triggers out like a web, and it starts to affect other things. So, like, mostly with women's health, I deal with the hypothalamic pituitary ovarian axis, and that regulates mood, sleep, ovulation, everything, and it's all dictated through the upper hormonal functioning. Yeah, because, like, I'm not really sure emotions are real. I know this is a very, very controversial thing, and because
I believe.
yeah, but they're driven by hormones.
Yeah,
and,
I can see that.
and you can switch it, and they're very, very fast because it's neurotransmitters.
So emotions are real. They're just driven
they're
by
real to
hormones.
you.
They're real. They feel real at the
real.
time, but, like, especially in my practice, I see a lot of people with anxiety disorders and PTSD and depression, and it's an exaggerated response to a stimulus that should not be happening. So if we kick it the other way, eventually the body will normalize and the reactions will change. So that's...
And they do change.
They do change, yeah.
Yes, they do.
I can't even thank her enough. I've seen acupuncturists in the past. They've always helped, but it's so nice to have you here as a resource on a regular basis.
Thank you. Yes,
Definitely
I'm
nice.
studying to become a subject matter expert on anxiety and acupuncture because there is so much peer-reviewed literature, and I think it's very valuable to have my research background here because I'm able to talk about it in a way where patients can understand it. Like, it doesn't seem so foreign,
Yeah.
you know, because it's not. I mean, we're all kind of built the same way.
Yeah.
So,
Interesting.
Yeah,
And so I have a question. So I've been an athlete my entire life. I've been a gymnast for eons,
Yes.
and I'm currently still a cheerleader.
Cheerleader,
not like
cheerleader.
rah-rah, but I actually do like some crazy
Yeah.
stunts.
no,
where I
I've
get
seen it.
thrown,
We'll put that
like,
link in
yeah.
the
Yeah, I get
I've
thrown like
seen it.
20 feet in the air and
It's crazy.
catching at,
Yeah.
35.10 years of my life it's difficult. It's a hard recovery. I have bruises all over my body.
You do.
Yes, I do. I get injured constantly.
Yeah.
I'm like still recovering from a torn calf muscle that was torn almost completely. So I mean, how would acupuncture play a part in my life for my physical health?
Yeah, so physical health is a big part of it. So tendon and soft tissue and ligaments, they're all guided by a particular organ system called the liver organ system. A lot of women are depleted out of liver blood for whatever reason, either hormonal birth control or... Is that the dog, like, licking my foot? Cute. Or severe diet restrictions. So it just basically means that their blood doesn't have enough to nourish the tendons and ligaments. So what I'll usually do for patients is put them on collagen protein, vitamin C, magnesium at night, magnesium citrate or malate at night, a Chinese herbal formula to bump up blood production, and then we can, like, heal it from the inside. Because Chinese medicine is not just about sticking a needle in somebody and killing the pain. Like anybody could do that. Like
Yeah.
that's dry needling. What we want in Chinese medicine is to get a proper diagnosis, because with every pain condition, there's an underlying internal mechanism that's going wrong.
Interesting.
Does that make sense?
Yeah.
So there's either like
That makes perfect sense.
like there's either
It really
like
does.
not enough combustion in the middle jiao, which is what we call like the digestive fire. So you might not be making enough hydrochloric acid. Like we
Okay.
call that spleen shi,
Yeah.
spleen yang.
Mhm.
So you're gonna get bruising and prolapse and like sagging of the eyelids, like all these other signs of aging that people shouldn't be getting as young as
Okay.
they are. Not you in particular, but just like saying, you know. So with that, we need to make several recommendations, like herbal formula, dietary formulas, needling. Obviously, like that's the main thing. But I shouldn't even need to put a needle in a patient. Like I should be able to make enough recommendations where they can handle it on their own. Because like my goal is to never see a patient again, for them to be done, healed, bye, and move on with their lives. You know.
Or some new problem.
Well, or you know, problems crop up, but
Yeah.
like that's the nature of this medicine. It's not for me to see you 3 times a week for the rest of your life. Like that's
It's
crazy.
not like a repetitive sort of
Yeah,
thing like you might need. Yeah.
Or you know, if it is, it could be like esoteric acupuncture for your spiritual development, but that's like another topic.
Oh, we
yeah.
love that too.
I
Let's
know.
talk about
Yeah,
that
yeah,
one
yeah.
next
Yeah.
time.
Yeah.
Well, since you were talking about, you mentioned dietary aids almost, so I'm going through my deep kalima, which you know, and so
Yeah.
like a deep cleanse. So I want to know, how does acupuncture
Yeah.
help with like a cleansing or a, you know, that kind of process?
Yeah, cleansing is necessary when there is a buildup of damp, like extracellular fluid or interstitial fluid that's not being processed. Toxic heat in terms of like alcohol or drug use, or you know, over use of prescription medication, or just like a terrible diet like greasy foods, sugar, whatever. And also when people get, how do I say this, like if things aren't going right on a chronic basis, then what we can do is increase digestion. A lot of stuff starts in the digestive fire, where things aren't being broken down properly or absorbed properly or whatever. So like the way that we think about it in Chinese medicine is that we start to separate out what's going wrong and fix the problem. So if you have damp, we drain damp and tonify digestion. If you have phlegm, we clear the phlegm, and then
Suddenly I have phlegm though.
I know, yeah, right? Yeah, well you do, I mean, you know. And so, you know, all this stuff can manifest in different ways, but because Chinese medicine is syndrome-based and not like symptom-based, we have like a sequela of symptoms around a diagnosis that we just are like bam, 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 and this is all part of this, so we treat that, and all of those go away. So we're not just like picking off symptom by symptom. You know what I mean?
Not
like
painting the leaf green.
Yeah,
You're actually
we're just-
nourishing the leaf.
Oh, I
Or
see.
tearing
So
the
that
tree
they-
out.
The tree. Okay.
Yeah. Or ripping the tree out of the ground.
That's a really nice way to put it. Not painting something, but actually nourishing it so it comes out with its own color. Yeah.
Yeah.
Oh, okay.
Yeah.
That's wonderful.
I like it.
And then, so how would you recommend someone get started?
Oh yeah, I have an auricular clinic. Auricular acupuncture. You laugh.
I laugh because I was gonna ask you.
I totally forgot.
My dog distracted me.
I know, he's such a baby.
And I'm just so in awe of like your knowledge and your
Look at him, he's so
I know his face is
Next time I'll bring needles for him.
Yeah.
So on Fridays I have an auricular clinic. It's on the external surface of the ear. There's a branch of the vagus nerve which regulates parasympathetic response, which is like rest and relax and kind of chill. We call it weekend vibes, all that kind of stuff. So there was like a French doctor and an acupuncturist who, I think in the 60s or 70s, they did an fMRI study where they like buzzed the ear and mapped it out. So where like
I've
hit in
heard
the
of
brain.
that.
Yeah.
Very cool.
It's very cool. I forget the name of the doctor, but one of the main doctors I think still works in Santa Cruz. Like I kind of want to go take classes with her.
And that's where you got the image of the ear and
Yeah,
how
that's
it
where
has
the-
all the
yeah.
different, like the
Mhm.
foot, the tongue, the, okay.
Yeah.
Okay.
The internal organs and stuff.
Yeah.
So I treat in that clinic I treat a lot of like insomnia and anxiety,
Mm-hmm.
and yeah, that's a great way to get started and to actually understand like how powerful it can be.
And to not be afraid of the needles.
Yeah,
I do
don't be
the ear
afraid of
clinic
needles,
pretty
like-
consistently.
You
I don't really
generally
like needles in
don't
general.
necessarily even feel them. I feel like you only
Yeah.
feel it if it really has released a lot of energy. If
Yeah,
you put it that way.
with auricular you want to have the like that kind of face, but you know I'm shoving metal in your body, you know. But
But it's not like a pain like
Really?
that.
It hurts for like a split
I
second.
would
Yeah.
I wouldn't even like
Yeah.
compare it to getting your blood drawn. I think
No.
that's more
The
traumatic.
needle
Oh my
is so
God.
small.
Yeah.
Well, more
Yeah.
important than the fact that it's even at 8 to 10 on Friday mornings,
Alright,
every
East
Friday
Side
single
Hours.
morning.
In
It's
here.
only $20 to see her for the first time
Yeah.
on that Friday morning during the auricular ear clinic. So come on by
It's
to
a community
148 Main
clinic.
Street, Suite G. We're always here Friday morning. It's actually quite fun.
It's fun.
I'll be here tomorrow
We have a
morning.
great time.
We have tea.
Yeah.
Sorry, 8 to 10.
8 to 10.
Okay.
Mhm.
Okay.
And it's nice to call in, let us know you're coming, but you don't have to. Walk-ins are totally available, welcome, and it's the best way to get started and meet Candace in person, Dr. Lopez in person, and then go from there. So she does do
It's
a
a fun
little
time.
consult with you and to talk about what you do want to have worked on or what could even be worked on.
Yeah, and it's in a separate room. So like what'll happen is the person will come in, fill out their paperwork, we'll go into the treatment room, I'll do a little intake, and then you come out here and get needled because it is a community clinic. And that's a powerful thing in general because
In general, the community healing, that's how we used to
Yeah,
always do
that's
it.
how we do it.
Always
Mhm.
community
Yeah.
healing. Plus
It's
you're
much better.
surrounded by these gorgeous plants.
I know, look at it.
And lots of good, kind hearts, and it's a good time. So come on
This
by.
room feels good.
Yeah. Thank
Yeah,
you
it
for
does.
joining us
Thank
today.
you.
Thank you.
Dr.
Have a good
Lopez.
one. And we'll see you next week for Soul Lab next Thursday.
Thanks,
Yes.
you
Bye.
guys.